Good morning, good afternoon, and a very good evening to everyone who's watching us live from various parts of the world. My name is Ruben Lobo on behalf of Team Dentist Channel Online and our speaker for today, Anastasios Papanikolaou from the beautiful city of Athens in Greece. We warmly invite you to this session on the topic multi-unit apartments. Ladies and gentlemen, we have a very special speaker, like I've mentioned already, Anastasios Papanikolaou from the beautiful city of Athens, Greece, who's going to talk about Novamind and everything that happens around as far as their manufacturing is concerned. Most of you all would be fascinated to know about All-on-X, All-on-4 implant system and various multi-unit abutments. And hence, this was one of the reasons why we thought, why not have a presentation which covers each and everything with regards to multi-unit abutments as well as All-on-4 and All-on-X systems that the multi-unit abutments come into picture. Our speaker for today, Anastasios Papanikolaou, is a certified dental technician and has worked for decades giving courses in advanced ceramics and implant restorations for dental technicians in different countries such as Greece, Turkey, Germany, and Belgium. He graduated from the prestigious American College of Greece in marketing and sales management. He has worked for many dental companies worldwide like the GC Europe, Dentsply, Cybron Implants. Since the year 2006, he deals exclusively with implants and implant prosthetics. In the year 2010, he joined Nova Dental Limited, one of the biggest companies in Greece in dental business. He took over to develop an industrial unit aiming to manufacture implants and prosthetics. In the year 2016, the name of the company changed to Novamind. Anastasios is in charge of the R&D department and is the commercial director of the company. He speaks fluent English and German. Ladies and gentlemen, presenting to you, Anastasios Papanikolaou. Over to you, sir.
Hello, ladies and gentlemen. Good afternoon from my part as well. I would like to thank Dentist Channel for this organization. I believe that this is very important in that time that we live all with the COVID-19 crisis all over the world. It's very important to have the opportunity to meet in this way and have the opportunity to change ideas, exchange ideas, and have all the dental business to move in this way. So I'm really pleased and honored for the invitation to speak to that session. And I would like to thank you very much all for attending this session. As Mr. Ruben told you, my name is Anastasios, and I am from Athens, Greece, in charge of a Novamind company, which is the first and only manufacturing company in Greece, in Southern Eastern Europe, that deals with implants and implant prosthetics exclusively. Our today topic is mainly multi-unit abutments and the use of multi-unit abutments in different implant systems. As you see, we have a special partner in India market, is a Medevise Technologies Private Limited, through which you can find our full portfolio of our products. So, Novamind has all the necessary certifications like CE Mark and ISO 13845. And I would like to share with you that the last couple of months we have started in combination with Medevise to make all the necessary actions to register the products in Indian FDA organization as well. Hopefully, after a couple of months, it's going to finish this process. You know, there is a bureaucracy in that process, and we're able to have our products freely in your market. So what does a CE certificate means? It's a very strict process. and contains very elaborate mechanical tests, as well a very extended clinical evaluation with a very big number of patients that get the products in the mouths for some time, for a couple of years, in order to get the license to have the products in the market. But never mind, apart from the certification mechanical tests, we do our own mechanical tests in cooperation with Endolab. Endolab is a German certified laboratory that testified dental implants exclusively. So we use their knowledge to testify certain production lots. We testify mechanical properties, there are strict mechanical tests, and also measurements. We measure the precision fit, which is very important for us. So when we started with manufacturer implant prosthetics parts, we had a vision. Our vision was to make the high-end implant treatment affordable to everybody. I remember back to 2005, 2006, when an implant prosthetic part, an abutment, was so expensive, sometimes much more expensive than implant itself. That made the implant prosthetic treatment very expensive to the people, so the people preferred to make a partial denture or a full denture instead of having the fixed prosthodontics, a very good quality of life that implants give. So what we wanted to do is to make affordable the implant treatment to everybody. So the idea behind the realization of this production was the following. No matter the implant that the surgeon has placed in the mouth, for example, Nobel, Straumann, etc., the clinician who is going to make the prosthetic part is able to use Novamind prosthetic parts from the beginning of the treatment till the end, without compromising at all at the quality. Our products have at least comparable quality, but significantly lower price. So we cover the biggest possible spectrum of compatibilities in implant systems. We cover more than 15 implant systems so far, like, for example, Straumann bone level, Straumann tissue level, Nobel Replace, Nobel Active, Astra, Xi Freelid, Zimmer, 3i, MIS, Paltop, Adin, and others. For full line, you can download our prosthetic catalog at novamind.gr. The last days, according to our records, I was really happy to be informed that more than 1 million Novamind abutments are already in mouths, not sold in dealers or in dentists, but already function in mouths. This makes me very, very happy. So, after 12 years of having this manufacturing unit, I'm really convinced that we have successfully reached our main visions. For the moment, we're, of course, market leader in Greece, but at the same time, we have developed a serious export activity in different markets. We have many countries that we export our products very successfully. Some of them most of them are in Europe, but we have others as well, like Lebanon, Iran, Russia, and Australia. And of course, India. So, before we go to the main topic, which is the use of multi-unit, I would like to make a history of implant prosthetic treatment to see how we reached at that point that we need multi-unit abutments. 15 years ago, implant prosthetic treatment meant mainly cemented restorations. Why? Because the clinicians wanted to imitate the conventional prosthetic approaches with the natural dentition. Like they had, they grinded the teeth, they had a die, they make impression of the die, they make a bridge, they make a crown, and then cemented the bridge. So for that reason, the implant prosthetic treatment was cemented restorations. These are some samples of the first cemented abutments that we did in different angulations and different gingival heights for different systems. What we try to do is to have some special features in our prosthetic parts. As I told you, what we wanted to do is to have a perfect fit, precision fit. All our abutments, I guarantee that they have a precision fit less than 2 microns in all implant systems. We did a bigger wall thickness in the abutments in order to have better mechanical properties, better strength, and of course, to give the opportunity to the technician to grind it in order to give the good parallelism without losing the strength of the abutment. The same way, we did the abutments a bit higher in order to give the opportunity to the clinician to have a restoration in cases where the interocclusal space was increased. Another feature is the inclination. In some cases, with the custom abutments, we could reach 45 degrees inclination without losing any strength of the abutments. The raw material that we use for the abutments is titanium grade 5. Allow me to say here that the titanium grade 5 is the best solution for making implant prosthetics because it has the best properties of all alloys, and it is the recommended of all the organizations worldwide. Of course, we have huge variety of products, and what we did is to invest in digitalization. We'll go back later at this point. So, with the time, the clinicians worldwide started to modify their approach in implant prosthetic treatment, turning more and more to screw retain restorations. The main reason was the accessibility of the implant after a while, which was difficult in cemented restorations. In most cases in which a clinician wanted to have access to the implant, for example, because a screw was loosened, was almost impossible. They should destroy the bridge, destroy the crown, because it is very difficult to remove it. So this was a huge problem. So they decided to go the screw retain restoration for better accessibility. In screw retain restoration, we have two big families. One family is the restorations with one screw that screwed directly to the implant. In this family, the first abutment that was used was UCLA plastic abutment. It is available in two versions with the anti-rotational mechanism like hex, for example, as you see here, or without it for bridges and crowns. This abutment is the conventional plastic castable in which the work is designed in wax and casted. It had some disadvantages like the poor precision fit, because due to casting, it is difficult to control the contraction of the alloy, so the precision fit in the implant was really poor. For that reason, the involvement of this abutment was the cobalt chrome cast-on abutment. This is the same thing like this, but the difference that we have a prefabricated part here that goes in the implant, so we have a perfect precision fit industrially, and then we can, with the conventional works and cementing and casting, we can design the restoration above it. With the digitalization, the need of another type of abutment for screw restoration was born. So tie-base was born. Tie-base abutment is this type of abutment. It is available in two gingival heights, 0.5 and 1.5 millimeters. You can see here some lines, which is essential that for the cementing afterwards, for the restoration, which is designed in the environment of a designing software and not in casting in conventional ways. We'll see some more information about it later. So, the second family of the screw retain restoration is the restoration that require two screws. One screw is on the abutment that's screwed directly in the implant, and the second screw above the abutment. The restoration, the final work, is screwed in the abutment. As a matter of fact, this family is multi-unit abutment or abutments that imitate multi-unit. Many companies have some like multi-unit abutments with a bit different platform, but the principle, the idea is the same. The real genuine abutment for two screws restoration is a multi-unit abutment. Multi-unit abutment have, we strongly believe that this type of prosthetic gathers many advantages and give us the opportunity to overcome several problems that we had in screw retain restorations in the past. We can have a look more analytically. First very serious advantage of multi-unit abutment is the one and only prosthetic platform. As you know, there is in the market a literally huge variety of implant systems for different indications. For example, there is a variety in connections, universal hex, octagon, conical connections, cone and hex, cone and octagon, different degrees of cone, external hex, many, etc. Many different connections of implants. Also, different platforms in each different diameter. One implant system can have 4 or 5 different diameters, and each diameter have its own platform. You can imagine that the management of this variety in a dental office is a huge headache. And imagine a recall 5 years later where you have a patient, you have placed 5 implants, for example, and you have 5 different platforms of different diameters. It's really impossible to record carefully in a dental office all this and to have all this stock of components of all these systems. Sometimes I have a call from dentists in Greece or in other places and tell me, look, Anastasios, I have a case, a recall case, in which I placed 5 years ago 2 implants in a guy, and now a screw is loosened, so I need some screws to manufacture for me. And I said, of course, we can manufacture, but bear in mind that each production lot that we have is 500 screws. Can you buy 500 screws? It's not possible. So the use of multi-unit solves this problem because we have one and only prosthetic platform, no matter what the implant is, in which implant is used, which diameter of implant, which connection of implant, you have to deal with always with the same platform. Another advantage is the versatility in making screw retain works in cases where the parallel axis is not correct. The main problem in the use of screw retain restorations that we have in the past in bridges or also in crowns was the limitation regarding the parallelism. In cases that the implants have been placed not in a parallel axis, the insertion path was difficult to be reached or sometimes impossible. So the clinicians that wanted to make a screw retain restoration sometimes compromise and make a symmetric restoration because they could not find insertion path for the restoration. The multi-unit abutment are available in two different angulations, 17 degrees and 30 degrees, so we can use these angulations in order to find the parallelism. In addition to this, we have on the multi-unit a conical platform, a conical external platform that improves even more the insertion path of the final work. And the most important, it facilitates the impression. Many of you, I believe that you, in the past, you have faced the problem that you have to make impression of 4 or 5 implants with poor parallelism and with impression posts that go deep in the hex of the implant, and you need to remove all this situation with the impression tray, the impression post inside, in implants that are not parallel. Sometimes it's very, very hard. You know the case. From mechanical aspect, the multi-unit abutment, of course, have in that case, in that sector also have advantage because it has been proved that the use of multi-unit transfers the tension and the lateral forces away from the bone and, more important, from the lateral walls of implant. This ensures a significantly lower cervical bone loss and consequently the survival of the implant itself. From biological aspect, the advantage is huge because the implant seals once and it never needs to open again. What you do is above the surface of the implant after that. The last studies have shown that each time that the abutment is removed and the implant opens, the more bacterial load is applied. In the case of the multi-unit, you close the implant, you seal the implant, you never have to open it again. In recalls, in the case of recalls, for example, as we mentioned again previously, when you have to remove a screw, a loosened screw, or you have to replace the screws, because in the recalls, in the screw retain restorations, after a while, after 1 year, after 2 years, you must replace the screws in order to prolong the lifetime of the whole situation of the implant. And you must tell your patients that they have to come for a recall, otherwise you are not responsible for the survival of the implants. So in that recalls, if you have a multi-unit abutment, it is the best way, the easiest accessible possible platform for cleaning or for replacing the screws. In addition, you can find multi-unit screws all over the world very easily. For example, a patient is traveling to the United States or somewhere else, and the one screw is loosened there. So it's very easy to find screws to replace in any dental office all over the world. Last but not least is the all-on-4, all-on-5, all-on-6 technique, which is possible only exclusively by the use of multi-unit abutments. So what happens in this technique? In the technique of all-on-4, as you know, what we try to do is to make possible the position of a fixed prosthodontics, a fixed bridge, not a removal, not an overdenture, in a case that a few implants have been placed. We place 4 implants in the lower jaw or 5 or 6 in the upper jaw. It depends on the case and some other factors that lead us to the decision. But as the general principle is that we place 4 implants, 2 implants with as parallel as possible in the area of canines, and 2 implants with this inclination from distal to mesial in the bone in the area of molars. In the first 2 implants, we place a multi-unit straight, and the second case of the molars, we case an angulate multi-unit. So we have a parallel platform, general platform, in which we can place a fixed prosthodontics that is made of lighter material. It is not a metal ceramic, which is heavy material. It is made mainly with a hybrid metal subtraction, a light metal subtraction, and on it acrylic materials, acrylic teeth, denture material. So it is screwed directly on the multi-unit. It is removed easily in a recalls, and the patient has a fixed bridge in the mouth. This case is only possible with the use of multi-unit. Multi-unit abutments have their own prosthetic components. So you don't have to work on platform of implant, as I told you before. You work on this platform of the multi-unit. The recommended way of working with them is to be placed either after the uncover of the implant, after a while, after the implant is also integrated, or in case of immediate load, you can place them just after the placement of the implant. In some cases, especially in cases of guided surgery, the surgeons place it directly after the surgery. In both cases, a healing screw is required to cover the multi-unit abutment, to let the soft tissue to heal around here. The healing screw is available only in this height, only in this one and only height, because its purpose is not the tissue manager, the soft tissue manager, is not the gingiva formic, because this is taken care with the use of different heights multi-unit. We do the soft tissue manager with the multi-unit abutment because it is available in different heights, in 6 heights as a matter of fact. So we do the soft tissue manager with this, and the healing screw is only covering the platform of the multi-unit. I would like you to see here the shape of this part of the transgingival part, which is in concave shape. All our prosthetic parts, all of our Novamind abutments are done in this way, which according to the periodology studies are the ideal for the soft tissue to adapt better in this. After a while that the soft tissue is healed, is ready to accept the prosthetic, the clinician has to make impression of the multi-unit platform. We transfer the multi-unit platform and not the implant platform. We use similar components like open tray impression post with this long screw, or closed tray impression Sorry. What is it? Without a long screw, the screw is inside here. It depends on the technique that the clinician wants to follow. After that, a plaster model is done, which, as you see here, we have a lab analog of a multi-unit. You see here the platform of the multi-unit, which is external heads and conical. This is so friendly to work with. We have a few and very friendly, as I told you, possibilities to restore this multi-unit abutment. First is that we can use a UCLA plastic castable abutment, which in this case is much easier to have a good precision fit here in this platform than in the platform than in a inside internal hex of implant. So in this way, as I told you, we designed the work in wax and it is casted. Another option that is gaining ground all the time is the use of the so-called temporary cylinder. The temporary cylinder in the beginning was used for the cases where a long-term provision was required. But many people use it in combination with composite materials that invest this abutment for permanent restorations as well. As you know, digitalization day by day all over the world goes deeper and deeper digital, all the people, all the dentistry. So also the multi-unit abutments can be used in combination with the technology, the digitalization, and the digital workflow. Our company gives all the weapons, all the components that you need to restore digitally a multi-unit abutment. In that case, we don't use impression post, conventional impression post with the impression material. We use a scan body or a scan post or a scan abutment. There's some other terms in the bibliography. This allows us, in combination to intraoral scanner or a lab scanner, to transfer all the geometry of the multi-unit platform and the peri-implant tissues in the model, or not in the model, in the environment of a software that in this software like Exocad, like 3Shape, like Dental Wings, which is a designing software. We can design the restoration here based on the T-base. There is a T-base that represents digitally in that design software this reality base, and on it we designed the restoration, the bridge, the crown, the hybrid, everything, which is on this T-base is cemented. In the beginning, the T-base was used only for zircon dioxide restorations. We can use it for zircon dioxide restorations, but we can use it in combination with metal substructures as well. The metal substructures are cemented on it. So these are the ways that can restore a multi-unit abutment. So you can see how easily you can make a bridge, a crown, everything in a multi-unit. In the digital, just see all the stages that we use. Intraoral scanning with the intraoral scanning. Scan post, as I told you, we use a scan post to transfer through a free downloadable library of NovaMind. We don't sell the library, we give it for free. This is not. This is an analog. As a matter of fact, it's a digital analog. You can see it in the screen. Digital processing through lab design software, and the T-base, as I told you, in different heights. So, as a conclusion, I would like to say that nowadays the screw-retail restorations are gaining ground, and multi-unit abutment is more and more highly recommended by all the experts all over the world. And I would like to remind you here that you can find all multi-unit abutments and all our other prosthetic parts through our exclusive partner in media, Medevice Ltd. At the end, I would like to thank you again once more and wish that I will have soon the opportunity to demonstrate free our products live, face to face to you, and shake hands with you as the nightmare of COVID-19 ends. I would like to thank you very much for your kind attention, and I am at your disposal for any question.
Thank you, sir. We now move to the question and answer session. The first question is from Dr. Shilpa. Can we use it for single tooth replacements?
As I told you, this is a good question, and I would like to refer to this because, as I told you, NovaMind is researching all the time and is developing all the time. The name multi-unit indicates that for the moment, multi-unit can be used mainly for bridges because there is no anti-rotational mechanism in the multi-unit abutment. However, we are working on making a single unit abutment, which is similar in platform, but with anti-rotational mechanism. It can be used for single crowds very soon.
Thank you, sir. We move to the next question. Question from Dr. Devendra Chopra. What problems does one face during the use of angulated multi-unit abutments?
Yes, always there is a but in the use of things. The only problem that we have faced mainly is the part that multi-unit angulated abutments, by default from the production, the way they are produced, they present a bit high transgingival part. The lowest that it can be is 2.5 millimeters. This, in some cases, we can have poor aesthetic because we don't have 2.5 millimeters gingival height. So in some cases, you can have the situation that you can see the metal. This is the main problem.
Thank you, sir. We move to the next question. Question from Dr. Manjusha. Is it better to go for screw retained or cement retained hybrid denture in all-on-4 implants?
All-on-4 implants can be done only with screw retained and only with the use of multi-unit. My opinion is that in general, in implant prosthetics, if you can use screw retained abutments, it's better to use screw retained abutments for the reasons that I developed during my presentation, for the accessibility in the future, mainly.
Thank you, sir. Participants, we are open to the live question and answer session. If you have any questions with regards to multi-unit abutments as well as the prosthetic components manufactured by NovaMind Greece, I request you to kindly post them in the question and answer box. For all those who have been asking me about the catalog, like Mr. Anastasios already mentioned, you can find out the complete product line as well as the catalog on www.novamind.gr. Okay, we have a question from Dr. Vaibhav. How to calculate prosthetic space?
What do you mean? I cannot understand really the question. What is the prosthetic space?
Dr. Vaibhav, could you be more specific?
Yes, please.
Yes, friends, once again, we are open to a question answer session. I request you to clear all your doubts with regards to multi-unit abutments. You wouldn't have anyone better than Anastasios himself answering to all your doubts, as he's the person, he's the research and development director, and he's the one who knows the science and the art of multi-unit abutments. So I request you to please post your questions in the Q&A box so that all of those would be covered, so that you don't have any doubts when you are placing your implants and when you are using multi-unit abutments. Okay, we've got the question once again. How to calculate prosthetic space, the space for fabrication of hybrid denture?
I believe that he means in the case of using all on 4, all on 5, or 6. Look, there are certain ways of the clinicians do it. I wouldn't like to speak from clinical aspect. I'm not a clinician. I'm not a dentist. I'm not a surgeon. So I don't believe it's correct to speak from a clinical aspect. There are certain rules in that case in bibliography that you can. For example, they say for 10 millimeters implant, you can have 20 millimeters high interocclusion space. For example, this is some general directions, but you know the science and the clinical application is not based always on rules. The clinicians can decide themselves, can evaluate the situation. Okay.
I hope the question was answered. We have one last question from Dr. Maria, who's asking, could you please share the slide of different color coding you shared in the beginning?
What to share? Tell me again.
The slide of different color coding.
Of the free?
Color coding.
Color coding, yes. It is. It's better to go to the catalog, which is much more analytical, the color coding. If they download the catalog, they will see freely what I mean. Each implant system has its own color, so they can see much easier with the color coding in the catalog. Okay?
All right. Yes, Dr. Maria, and to all those others who are interested to know more about the complete lineup, to understand the different color coding for every single product, you can log on to www.novamind.gr and find your catalogs and find the best match for all your doubts.
Just to add something at that point, that our components, our abutments, have the same color coding like the genuine one. For example, in Nobel Replace, compatible abutment that we have the same color coding. The diameter 3.5 has purple, the diameter 4.3 has gold, and the diameter 5 has blue, for the people who are familiar with this system, I mean. But they have absolutely the same color coding as the companies that have the genuine abutments.